maybe like 5 minutes before I get started because I didn't schedule this live. But I decided since I had to do an assignment on here, I may as well go ahead and my B2B's it's just off the chain. I may as well go ahead and do an update because I know you guys have been waiting and I have been neglecting you guys, and for that I apologize. But let's give a minute for those who do have the alert on their phones. When I do go live, if you don't have the alert on your phone, I would suggest you subscribe and put the alert on so you know when I do get on here, because as you guys know that I am hey Anthony, as you guys know, I am very bad with scheduling these lives for now. I said once I got done with school that I would get a little bit better with the lives, but I started school again like a crazy person. So I'm going to just give it a couple more minutes before I actually start talking about the end of the FNP program. I think I left off like I think unit 10 of the FNP. I did not reach back out. I was just so busy that last term or whatnot. Let me see. Actually, I will. Let me see. There we go. Anthony Smith, how are you? I can't believe we made it all the way from Excelsior. I know, right? Why did it go away? I started my MSCM program this month. I understand, yes. Hey, Latoya. Yeah, it's been crazy, you guys. So I know I neglected you guys the last term of the program. It's just like I was super duper busy. So let me go on here because I can't see the chat on here. So maybe if I go on live, let's see, videos live. I want to be able to see the chat so I can mute my my laptop so I don't get the echo. Okay, here we go, live. And then I can read the comments on here much easier. So let me mute this. Okay. Now, let me see the chat. Let's see. Here we go. Much better. All right. Anthony, I'm doing good. I'm just like overwhelmed. Just a lot. So I'll talk about that. I'll give it one more minute before I jump in. Amira Israel, hey princess, I pray all is well with you. Are you graduated already? Wow, that's amazing. Yes, girlfriend. So I'm going to jump in, but I'm going to go ahead and just wait a minute. Let me see. I want to apologize for my edges. Now, I have on pajamas, but I have this lab coat on because I just had to submit an assignment. So, 15 more seconds. I'll jump right into it, and feel free to ask me questions as we go along. So, I feel bad. All right, 5 minutes in. So, I completed the family nurse practitioner program. as you guys already know, it was, or some of you know, it was 16 months for me. I did the accelerated track or whatnot, in which the first 10 weeks with Purdue, the weeks are the terms are 10 weeks versus 12 with Capella. It was 12 or whatever. So I so I told y'all I'm all over the place. So I completed it, and the first 10 weeks, the first term was just like Capella, write as many assignments as you can in one billing cycle, and I did it, and like it took a minute for me to jump back into it because I was like so burnt out from Capella writing those papers. And so I went in and went on and finally got in the mood to start the Purdue University Global assignments fast track, which was the same as Capella, writing papers and PowerPoints and um, so forth. And I got done with that. Like I said, I didn't get started for about seven weeks in. I had 7 weeks left. So I put a lot of stress on myself for doing that. So anyway, I completed. So the first 10 weeks is the accelerated one. So for some people, it's going to take more than one term. Uh, and it may take you 2 terms or whatnot. But once you complete that first term, all those assignments, not first term, but all those assignments, which is approximately like 32 assignments, once you complete those, and then you start the traditional path. And so the traditional path is not go at your own pace, it is traditional. Like you have 2 classes, or you can opt to take 1 class for um, the 10 weeks, and then you, after like 3 classes, I believe 3 or 4 classes, you go into your clinical courses. And I basically told you guys what those assignments entailed, which was basically a seminar, a weekly seminar, a weekly discussion in which you have to post your initial discussion, and then you had to respond to 2 other students' discussions. And it was a weekly quiz, which was like worth 5 points or 10 points or whatnot, depending on the class. And then you also had maybe one additional assignment that you had to do. So one week would be a seminar, an assignment, a quiz, and discussion board. And then you have a midterm, which the midterm could be like 50 questions or maybe 25 questions. And then you would have the final, which would be about anywhere from, I think the final was 50 questions actually. So I didn't do too well with the quizzes and the midterm, and that's okay because I still passed the class with either an A or a B. So you don't have to be discouraged. Like, oh my God, they have proctored, which means that the teacher is not actually looking at you, but you are being recorded. So if a teacher gets a red flag or something, which means you're talking in a video, or someone in your home is talking in a video, or you are constantly your face is not visible to the camera, then it would be like red flags and alert your your professor, and she would probably look at that video to see what's going on. But it's not like someone's just staring at you take the exam or whatnot, but it is recorded. But like I said, they don't weigh that much. So long as you're getting 100% or close to 100% on your discussion boards, and you're attending the seminars. If you don't attend a seminar, then you can do an alternate assignment in which you would go and watch the recorded seminar, because the seminars are recorded. So you would watch that seminar, and then you would just write a synapse of the seminar or whatnot. But it's a rubric, just like every assignment. It's a rubric that you must follow when you do that alternate assignment. I don't have time to do extra assignments, so I always try to attend the seminars, and I set alarms or whatnot so I don't miss the seminar because I really don't have time to do an alternate assignment. And you have some lenient professors, and you have some strict professors that want you to go off the rubric and actually answer the questions as the rubric states. So you don't want to miss a seminar. So that's that with the classes. And so then you get into the clinicals. So now you have to go, you have to have a theory class, and then you have the same assignments: the seminar, the discussion, the assignment, and the quizzes or whatnot, the midterm and final exam. So clinical class, with the clinical portion, you also have a class, and in that class, that is when you when you go to the clinical site, like you were for the family nurse practitioner, you have to see a minimum of one patient per hour. You have to do 160 total hours for the program. So therefore, you would have to chart on, say you were there for 5 hours, you would have to chart on 5 patients. And they have their charting system. It's called Course M's. So you would go in there and you would chart on the patient. And that charting entails is you have to put in the age of the patient, the race of the patient, the chief complaint, um, subjective information, objective information, past medical history, and you would have to do the follow-up plan, like what was the plan, the medication you would give them, the diagnosis. You would have to put an ICD code in and a CPT code in, and you'll learn what all that is. And so you would have to. My phone is about to die, so I need to get my charger. But you would have to put in CPT, ICD codes, and then your plan, what you diagnose the patient with, um, what medications, what pharmacological treatments, and non-pharmacological. I just can't talk today. Treatments, and you would any referrals, any tests that you did, any results or anything pending, things of that nature. That's what you have to put into Course M. So that's the clinical portion. So then you also have to put your hours in. You can't say that I was there for 8 hours and I didn't get a break. For Purdue wants you to have a break. So I mean, if you don't get a break, then you just have to talk to your professor, like, hey, we did not get a break. And there's a comment section when you input your total clinical hours for the day. There's a section where you can actually put in, I took a 30-minute break, or there was no break, or whatnot. And then you just say whether it was a telemedicine visit, or an in-person visit, and you submit it. It does have an option there for you to upload some documentation or something, but you're not to upload anything. You have to type everything in. So that just sums it up as far as what to look forward to if you decide to go to Purdue for the family nurse practitioner program. Um, Let me see anything else that I can think of. That's basically it. The clinical class does not have midterms and final exam. The clinical class have your midterm is reaching out, the professor reaching out to your preceptor. So they have to have a phone conversation, and the phone conversation is really less than like 30. It's like about 30 seconds to a minute, if that. And then at your final exam is you get an evaluation that you survey, sort of like, that you have to fill out about the clinic, and then your preceptor gets one that they have to fill out about the student, and that's your final exam. They both have to be submitted in order for you to pass the class. So that's that. So during the FNP program, I did speak to you guys about, when I could, I would come on weekly and speak to you guys about what type of assignments I was um, doing or whatnot. So I kind of slipped on the last term, but nothing changed. It was the same. So they do try to prepare you for the certification exam. So they have, as of now, they have what they call what was the what was the let me see, Barkley review is what they use. So with Barkley review, the last 10 weeks, remember I was going on here and I was doing my studying with you guys, and I stopped that because the school actually had a review the last 10 weeks, which is the last term, and it was with Barkley. And so you would get weekly assignments that you would have to do, um, assigned by your professor. You would get weekly assignments, and you had to go to Barkley, log into Barkley, and actually do those assignments and take those quizzes and exams or whatnot. And it was like a pre exam and a post exam or whatever. And it just was, the post was basically to let you know how ready you were for the certification. And then also that post exam, the pre did not count for anything, nor did any of the other quizzes. They were just to make for you, for your own good, for your own studying or whatnot. But the post exam did count. You had to upload your results to your classroom, and that is what they use for your final exam. Um, so they try to prepare you with baits. So now I will talk about as far as the certification. Basically, preparing for it. So I took the certification exam 4 times. Um, so the first time I was nowhere near ready. So I'm used to like the NCLEX or whatnot. Both the LPN and the RN, you guys know, I went in there and I only had to answer the minimum amount of questions, and I passed on the first try. So with LPN and RN school, I feel like they kind of prepare you to go and sit for boards or whatnot. So some people have ATI or whatever, which they have to complete and get a green light before they can go and test, or um, different scenarios, different preparation platforms for different schools, but they kind of prepare you to go take the NCLEX. So what I would do is whatever platform that the school used, which was ATI, I would study the ATI, make sure I was ready, but I would also use my NCLEX book throughout school and to make sure that I was ready. So, and then I would go take the test the first available date, and I was successful. So no, not with the FNP. It's not the same. A lot of people graduate the program and then they go pay for a in-person 3-day review where they spend about $600 or more or less, but in the hundreds. And they, you know, and then they feel ready to go take the boards. I mean, those review are very intense. You go somewhere out of state and 3 days of just nothing but FNP review. And then they go and test. Some are successful, some are not successful. But what I did is I used my delete book, and I answered the questions in the back of the book, like maybe 2 times. And I did the Barkley review that the school offered. And what else? That's it. And so they do give you a blueprint. By you can take either the ANCC or the A what is it, AANP, one of them. American, yeah, AANP. You can take either one of those. Now let's talk about the difference between those two. The ANCC has select all apply, but they tell you how many to select. The ANCC has pictures, drag and drop, professional roles, Medicaid questions, the level of evidence, which one is the best evidence, which level. They have just a variety of things, and then clinical questions, where the AANP only have clinical questions. That's it. They don't have any professional roles. They don't have any Medicare, Medicaid questions. They don't have any select all apply. It's just multiple choice, all clinical. So you choose the exam based on the kind of test taker you are. Me, I'm not the test taker where I am only getting asked questions. I could, like, AANP was not my favorite. All clinical questions, it's never switched up. I can't do that. The ANCC was my favorite because to be honest, to me, it was a lot more easier, and it switched up. Like, you can ask me clinical questions, but then give me something different. Give me a drag and drop. Give me a professional role question. Give me a Medicare question. You have to switch it up for me. That's the kind of test taker I am. You may be different. You don't want any select all apply. You don't want any pictures, no drag and drop, none of that. You just want to answer clinical based questions. Then the AANP is for you. So let's talk about me testing 4 times before I passed. So for both exams, they give you a blueprint, and they tell you exactly like what they're going to test you on, what domains and what body systems and everything. So where I messed up at is I did look at the blueprint for the AANP at the beginning of my studies, my start of studying, and I never revisited. So you want some bacon and pancakes? Yeah. Okay, just a moment. I'm going to finish this one up, and then I'm going to do a part 2 where I talk about the psychiatric mental health nurse practitioner program. So let me finish this up real quick. Okay, Aiden? Just a moment, okay? So, where was I? Oh, so it was a lot of older adult and geriatric questions on that AANP, which I really did not hit heavy on. So I can't blame you. Guys know me. I keep it real. And if it's my fault, it's my fault. So I did not hit hard on those questions. I mean, studying or whatnot. So I failed that one. So I felt confident going in because, I studied like I've always studied in the past for the NCLEX or whatnot. But like I said, that wasn't enough. So I failed. So it's okay. So you can take the AANP 3 times within 1 calendar year. So if you take it again, you have to take it. You have to do 15 CEs and submit and show that you've done 15 hours of CEs. So I had to do that before I could test again. So I took ANCC. Felt confident about, passing it or whatnot. And so I took it at home. That was horrible. So you take it at home. So I had irritable bowel syndrome. Like, before even getting started, I had to use the restroom. I'm just going to keep it real. You guys know I keep it real. So if you don't want to hear about bowel movements and stuff, then you probably need to log off right now. So, but yeah, I had to use the restroom. Um, so I had to be on a computer. It was a proctored exam, ANCC offers. I had to be on the computer at like 3:30 or something. I think that was my test time. And I was in the bathroom at like 5 minutes until time to log on. So, what gave me anxiety is I read it was saying, so when you go to the testing site, they give you a scrap piece of paper, and you can dump on there or whatnot. Like the NCLEX, you can't dump or whatever, but taking the FNP, you can dump on your scrap sheet of paper. So I plan to dump, and I also plan to write on there, like, whatever I want. I needed a scrap sheet of paper. So they said that you don't get a scrap sheet of paper, and then they say you don't get a break. It depends on your proctor or whatnot. So I'm freaking out. I'm like, oh my God, I don't get a break. So I'm in the bathroom putting on 2 overnight maxi pads, because I'm thinking, like, for sure, I'm 4 hours. You get 4 hours to take this exam. The AANP, you get 3 hours to take it. So for this one, I'm like, I gotta sit for 4 hours and I can't go to the restroom. It's a possibility that I can't go to the restroom. So I'm like freaking out. So I'm putting on 2 overnight pads. Like, I'm gonna have to urinate on myself sitting at that, while I take the test. So I get to the computer. It's time to check in, and my time is running to check in or whatnot. No, it wasn't running yet. I was checking in. But so I'm checking in. So you gotta show your sleeves, your arms or whatnot, and you gotta show under your table, your whole surrounding and whatnot. Yeah, it was stressful. So you have to show your surroundings and whatever. So now I'm taking the exam and I'm feeling good. I'm kind of nervous, but I'm like not to the fact where I'm thinking I'm going to fail. So I'm sitting there. I'm like, okay, I'm going to answer 100 questions, and then I'm going to take my break. They said I get a 10-minute break. And they said I can't have a scrap sheet of paper. I have to use the computer pad for my scrap sheet of paper. Okay, that is just like not the same. So I did not use that. So anyways, I'm taking a test. My plan is to stop at 100 questions and go and take my break. So the questions, I'm taking them, they're seeming easy or whatnot. And then but the whole time I'm feeling like I'm about to freaking have a bowel movement. So I'm like, oh my God, I have to stop. I was at 60 questions. So I was like, okay, I'm ready for my break. Oh, and I was freezing. I had to turn the heat up because I was freezing. I was like, I have to take a break. I have to go have a bowel movement, and I have to turn up the heat or whatever. So I go have my bowel movement, and then I come back. I forget to turn up the heat. I come back and I start stretching in front of the computer. So he's like, okay, he had an accent or whatnot. He's like, okay, let me check you in. I'm like, wait a minute, I want to go ahead and take my whole 10-minute break, because the 10 minutes is not up yet. And he did not comprehend what I was saying at all. So I had to check back in. Mind you, my time is running, so I have to show my arms and glasses, do the whole check-in security process again. And my time is running. So I forgot to turn the heat up. So now I sit back down and I'm taking the exam. It still doesn't seem hard. You know, I'm thinking I'm doing good or whatnot, but I still feel like I have to have a bowel movement. So now I don't have any more breaks. So now I'm sitting, you know, taking a test, freezing because I did not get to turn the heat down, and I still don't have my scrap sheet of paper, and I'm feeling like I'm about to, excuse my language, shit on myself at any time during the whole. I had only answered 60, and I had to answer 175 questions. The whole time I'm feeling like I'm going to poop on myself, and I'm freezing. And not only that, every time the proctor switches, a chat box will pop up on my screen and say, "Hi, I'm such and such. I'll be your proctor." And I would have to close the screen out. And so just imagine in deep thought trying to answer questions, and every so often the screen is popping up. This had to happen like 5 or 6 times. And I'm like, seriously, how can I focus? And this is a screen is popping up that I have to close out every time you guys switch a proctor. So that was that. So now I'm almost to the end. My heart is pounding. I can feel my heart beating out of my chest. I'm like just all over the place. So with even though all that was going on, I still thought I passed. So they don't give you the results immediately. The AANP give you your results immediately. You'll know if you passed or failed before you walk away from the computer. Well, the ANCC, you have to wait until you log off, finish the exam. If you at the site, you have to wait until you get to your phone, and then you have to go to your email and read your results. So I got my results. I'm going to my email to read my results. I'm happy, and I'm like, I know I passed, and it said failed. So I'm like, what the? I failed. So okay, I failed. So now with the ANCC, if you fail, you have to wait 6 weeks. You don't have to do any CEs, but you have to wait 6 weeks. Thank you, Kimberly. You have to wait 6 weeks before you can test again. So now my test date for the AANP has come. So, okay, let me go take the AANP because I know I'm going to pass this time. So, I told you guys what I used to study. So now before I go take the AANP again, I did the Sarah Michelle crash course, which was $139. I did her test bank, which was $39.99 a month. And the crash course was, like I said, $139, I believe, and you get it for a month. And the test bank is a monthly subscription for $39. I also did the APEA Hollier her test bank, and her test bank was probably like I think $40, and you get it for 6 months. And then with the Leap Book, you get access to quizzes and exams and everything on you download the app. So that's what I use to study. So I'm studying my butt off, so I'm like feeling like so prepared. Like I know I got this. Like, okay, I gotta go take this test again. So with the ANCC, you can take out. I think I told you. Is it 4 times? The AN. Oh no, the AANP you can only take 2 times in 1 calendar year. The AN, and then you have to do CEs also, 15 hours of CEs to retake. The ANCC you can take 3 times a year, but you have to wait 6 weeks. So anyway, so I go take the AANP, and I'm feeling confident. like, I took a beta blocker. Someone told me to take a beta blocker to, mask the anxiety or whatnot. So I took a beta blocker, and I took it like 15 minutes before I tested, and I go in there, and I get my scrap sheet of paper, and I take as many breaks as I want. So I'm testing. I'm feeling good. I'm like, oh, these questions are pretty easy. They must know I failed the first one or whatever. So they're trying to give me an easier version or something. So that's what I'm thinking. And I'm like, yeah, this is good. I did not have the heart palpitations. I did not have as much anxiety as I did the second time taking the test. Remember, this was my third time. So, but I still had to go have a bowel movement before the test, in the middle of the test, and towards the end of the test. So I still have the irritable bowel syndrome. So anyway, even though I had to use the restroom like that, I'm still thinking like I passed the test. Mind you, I was like thinking like, okay, is this beta blocker going to stop working? Am I going to have the heart palpitations? Am I going to get the anxiety? I was thinking that also the whole time that I was trying to focus on the test. So regardless or whatever, I'm like, okay, it's over. It tell you right on the screen when you get done whether you pass or not. I'm like, I know I passed. Like, I'm smiling at the computer and everything, and it said failed. So I'm like, what the fuck? Excuse my language, but I'm just like, this. I'm staring at the computer waiting on it to change. And so they say the results that you get is just it's not definite results. So I'm just like, I know they're gonna send me something in the mail saying this is the results, the real calculated results you actually passed. I'm like, how did I fail? How? As much work as I put in, how am I failing? Like, I just don't know how I'm failing. I all of a sudden had IBS when I wrote my NCLEX. Yeah, it's just like crazy. So I'm contributing. Now I'm tripping. I'm like, something's going on. I can't, it's nothing else I can study. It's nothing else I can do. What more can I do? It's not the knowledge, it's something else mentally going on with me because I have studied my ass off. I have the foundation. I know this stuff. I'm like, I have to talk to somebody. I have to talk to a psychologist or something. So thank God. Shout out to my friend from California, Mike, and his wife Victoria. He knew of a friend of his used to be a preacher and he retired to be a psychologist. So he was like, if you want to talk to a psychologist, I got you. And so I'm like, yeah, I need to talk to somebody because something else is going on. I don't know what's going on and why I'm not passing this exam, but something is going on. So I was thinking today, I was talking to a friend because I never had any anxiety, ever had anxiety. So the test anxiety just came out of nowhere. Well, it was COVID when I developed anxiety because I would have everything delivered, or I would pick it up. I wouldn't go into stores or whatnot, but sometimes the lady that I worked for, she would have me go to the grocery store, and I would always like have anxiety about going to stores or whatnot. And so I think that's where the anxiety started from COVID. I've never had anxiety like that. And so I'm like, that's what it is. So now I have this horrible test anxiety or whatnot. So I talked to the psychologist. He just basically told me, like, first of all, when you were taking this last exam, you were focusing on trying to pass the exam, but you were also focusing on your anxiety. And that's what anxiety is. It's the anticipation of having anxiety. So even though I thought like I didn't have the anxiety and a beta blocker was working, I still was thinking of it and I still was anticipating the anxiety to surface or whatnot. So like you said, you cannot, your brain can't focus on two things at one time. It's either the test or the anxiety, and my brain chose the anxiety. So I don't know what I was picking as far as answers for that exam. Even though it may have appeared easy, I was not all the way there. So I'm like, okay, when I go take it again, I mean, do I, he's like, everybody has some form of anxiety. So you have to learn how to deal with your anxiety. So I'm like, okay, when I go test again, do I take the beta blocker and just have confidence that I would pass? He's like, don't take the beta blocker because that's just a crutch. And he recommended this supplement that I just take every day or whatnot. And it's called Happy Healthy Hippie. I got it from Amazon or whatever, and it has all the great supplements all in one or whatnot to help you with anxiety, depression, whatever you may have going on. So I just take it daily. He was like, order it now, start taking it before your test date or whatever. Don't take the beta blocker. It's just a crutch. Go in there. You know you have the knowledge. You know you have the foundation. I have to go get my charger before this phone dies. Hold on. Oh my God, Aiden. This don't make any sense. Here, I'm gonna go get her charger. All right, I am back. Let me charge this phone up. Let me see how far I can put this. Okay. All right, here I go, my little fat butt. Okay, so I got that. Okay, so where was I? So, and then he also told me like, don't eat anything. So he said to eat the night before, time and give my body enough time to digest the food or whatever. And don't eat any breakfast. And then I also learned that your brain works best on an empty stomach. So, okay, hold on. I don't know. Excuse me. When you fat, you know, you running up and down the stairs, you get a little winded or whatnot. Your girl gained a little weight. I thought when I started nursing that these breasts was gonna go down. These breasts are still large and in charge. But anyway, that's another story. So, so I took his advice, and of course he talked to me about some other stuff. You know, gave me some more tips or whatnot. But so I didn't eat the the day of. I forgot and I messed around and had 2 brownies at like midnight. So I'm like, damn it. So therefore, my exam was I had it scheduled for 8:30. It was like 15 minutes away. I had to be there 15 minutes early, so I had to be there like 8:15 or whatever. So I usually don't study the night before a test, but I did answer. Hi, Vincent. So I did answer do a question bank or whatever, and so then I thought it was 100 questions, but it ended up being like freaking 150, and it was like 12 o'clock, and I was like, forget it, I'm going to bed. So, are you doing an assignment now? No. What do you mean by an assignment? Because assignments like could be work related or school related. Um, so, uh, so I took his advice or whatever, and I didn't eat breakfast. So I went to test. I got there about 8 o'clock, and so I went in, and I um, I I was confident. The night before, I called all my praying friends and I said, pray for me. I text them or whatever. I'm like, pray for me. I'm going to take this test in the morning. Usually, I don't tell anyone when I'm going to test because I don't want to have to call everybody and let them know that I was not successful. So, but this time I did go and I did call people and I'm like, I'm not taking this test again. So let me get all my prayer people, prayer warriors together and let them pray for me. So I go and take the test, and the AANP is just like you go in. They say, do you have anything in your pockets? Do you have a phone? They give you a lock or a key. They check your ID. You have to have two forms of identification, a credit card, and a driving license is what I took. And then you lock things up. They don't search you or anything, or make you lift your pants leg and your arm, your shirt up to show your forearms and whatnot. When you go to the ANCC, they actually have you go and they have a little wand where they try to make sure you don't have anything. They have it's like they have you empty your put your hands in your pocket, make sure nothing is in your pockets. They if you wear glasses, they check your glasses. The AANP also does that, but they check your glasses to make sure it's no recording device on there. It's a thorough process. It's like, I don't know if you guys ever went in to visit someone in an institution or whatever, jail or something, but it's comparable to that search or whatnot. So I went in, I'm feeling good, I'm feeling confident. I took all the his advice, the psychologist, and I'm ready. But I ate that brownie at 12 midnight. So before I took the exam, I checked in and everything, and then I said, "Can I use the bathroom?" They said yes, and so I went to the bathroom, and I had a bowel movement. So I said my prayers in the bathroom. I said, "Lord, let me be successful at this exam. Please leave all the nerves in the toilet with this poop. Sorry, like I said, y'all know." Sorry if you wanted to log off, but you did log off and you had to hear that. But I'm like, leave these nerves in this toilet with the poop. Because when I go out there, I just want to take the test, and it's 175 questions, and that's that. I just want to be done this time. I'm like, Lord, I have the confidence. I believe I put in the work. I have the knowledge. I believe that, I have faith that you will guide me with this and taking this exam and passing it. So I went in there and I sat down and took the test. So on my dump sheet, I wrote on the dump sheet, I will pass, God is good. And then it was 175 questions. So I did two boxes. I made two boxes with 50 and wrote 50 in it. And then I made three boxes and I wrote 25 in it. So that's just a psychological thing for me because 175 questions is a lot to answer. So once I answered 50 questions, I crossed that box out. Once I answered 50 more questions, I crossed that box out. So now I'm like, oh, I only got three more boxes of 25 to go. So that actually worked for me. I also, when I got a question, say it was an asthma question, then I would just stop reading the question and I would write down what I knew about asthma or the asthma chart so I can answer the questions correctly. The same with kidney failure stages or whatever, the GFR. I would just write down the normal values. Like that's how I was went on taking the test or whatever. So I'm answering the questions. I'm like, this test seems easy. This test is so freaking easy is what I'm thinking. So I'm telling myself, like, be quiet, Angela. It's going to get harder, so stop it. You know, don't get too excited. Don't get to acting crazy where you're going to have this anxiety and stuff. So I'm like, okay, calm down, calm down. I'm not thinking about any anxiety. I didn't have any anxiety. The test questions were so freaking clear. When I say I did not feel like the test was trying to trick me, you know, they asked a question, and to me, it was only one correct answer. It wasn't nothing that I had to think. Is it between A and C? None of that. It was so clear. It is crazy. Someone had to pray that, make that exam clear to Angela, because when I say 175 of 175 questions, I probably flagged maybe 5. That's how clear it was. And so it's 175 questions, but 25 of the questions they throw in there, they don't count for anything, and they just want to see how good students do with those 25 questions to make a decision whether they're going to add it to the next exam. And so I notice when one of those are in there, and I'm like, what the heck? This must be one of those ones they threw in, because I don't know nothing about this. But I didn't even have that feeling. Everything was so clear. And so I took that exam, and I was taking it with confidence. I imagine this is advice I would give also, is to picture for every question, picture yourself in that office visit with that patient, talking to that patient. Like, picture yourself as a physician, talking to that patient, and coming up with the management or treatment or whatnot. That's what I did for every question. And when I got done, so usually it's a survey at the end. So when I got done, it was like the survey didn't pop up or whatever, or I just clicked like I'm finished or something in exam, and maybe I wasn't supposed to do that or whatever. So now I'm like, oh shit, the test does not even count now, because I did not freaking do the survey. I thought the survey had to be done in order for your exam to count. So I went out there like, so they're like, let me print your results. I'm like, I don't think that the ANCC have results. I think I have to just see it on my email or whatever. She was like, well, let me see. And then she's talking to the lady, or the coworker, and she's like, the results was here, and then when I went to print them, they disappeared or whatever. And so I was like, well, I'm freaking out because the survey didn't pop up. And so come to find out, the survey is optional or whatnot. And so thank God for that. And so I went and went to the car. They was like, I'm sorry, I know this was nerve-wracking. I was like, it's okay. I mean, long as I know that the survey doesn't determine whether I completed the exam or not, I'm fine. So I went and I was like, I know I passed, so that's not, why I wanted the results or whatnot. And so when I went to the car, I checked the phone, and I went to my email, and it said pass. And it's like, wow. And I said, why did I have to go through all that? Why did I have to take the exam 4 times? And I guess I'm a firm believer if everything happened for a reason. So I guess this is like a testimony to help someone else out, where someone, might have went through the same thing, or, is going through the same thing, or scared of going through the same thing. So I don't mind, being the person that has to go through something to share with someone else, so they don't have to go through it. You guys know that about me. That's why I started this YouTube channel. So anyway, I probably should do another video just talking about my experience with the exam or whatnot, because this is an hour-long video, and you kind of gotta wait until you get to the end to get to the nitty-gritty about the exam. So I'll probably do another one just so you guys don't have to watch that. If you see I post another video that's saying my experience with the family nurse practitioner exam. You don't have to watch that because it's just going to be a repeat of what I'm saying right now. So I do want you guys to know that once you pass the certification exam, it's not like an RN or LPN or anyone else. You don't immediately go start working. You have to get it's called credentialing. I don't know exactly what the process and what that entails. I have to look that up, but it takes about 2 months. And if you want to work in the hospital, it takes about 3 months, I've heard. So, and that's not just a one-time thing. That's every time you switch nurse practitioner jobs, you have to go through the credentialing process, and it takes 2 months. And that's why, as a nurse practitioner, you have to, if you do plan on leaving your place of employment, you have to give them a 2 month notice, not a 2 week, a 2 month notice, because it's going to take that much time for them to get someone else credentialed and take your spot. And then also, it's going to take that much time for your new employer to get you credentialed. So I'm not even working as a nurse practitioner yet. So some of my classmates, I didn't know that what they were doing. They had jobs right out of school or whatever after they took their certification exam, and that's because they already had started the process of being credentialed. So when they tested and passed the exam, they were able to start immediately because they already did that process. And that's what I'm kind of bummed out, because nobody told me that. And so I wish I would have known that, but it's okay. So now I'm doing a YouTube video about it so you guys can know, and you guys won't be sitting around twiddling your thumbs and working as an RN. I would have never stopped working, taking care of my lady. That was the easiest job ever. I loved her. I loved everything about it. I would have just continued to work there, but I put in my 2 weeks thinking that I was going to start an NP position immediately, and that's not how it works. It's a freaking 6 to 8 week process for credentialing, and longer if you want to go to the hospital. So that's that. That's where I'm at now. Sorry, it took. Okay. Sorry it took so long for me to do this video, but the last term of the program, I really had to study. I was really studying, using their platform, trying to make sure I passed the certification exam. And then I got sick. It was the worst rhinovirus I've ever experienced. And then my son got sick. And then, hey, calm down and wait a minute. I know you want some more crackers, but you have to wait a minute. I'm almost done. So, say hi. Hi. Say I'm 3 years old. My name is Aiden. Spell Aiden. How you spell Aiden? D-I-E-N. No, A, you have to start A. A-I-D-E-N. Aiden. Yes. Now, can you spell Rouse, your last name? That's right. Good job. Wow. I'm so proud of you. But anyway, did you just poop? Mm-hmm. Say excuse me. So anyways, I lost my train of thought with this little. I forgot what I was going to say. But thank you guys. Oh, I got sick. Aiden got sick. Then I had surgery. I had some fibroids and the cyst taken off my ovary. And I also had a bladder spleen put on or whatever. I had some complications with that. But I'm good now. I'm good. So thank you guys. I apologize. And I hope this update helps. Do you guys have any questions before I log off? Any questions? If not, just say bye, hi, see you later, or whatever. I'm looking at the chat to see if you guys have any questions, if I missed anything that you guys were looking forward to hearing. Nope, no questions? I think it'll show if someone was typing also. All right, bye guys. Thanks for watching this video, and I will talk to you guys in another video when I talk about the psychiatric mental health nurse practitioner program that I am now doing, in which I started. I graduated February the 22nd, and I started this program March the 2nd, like a crazy lady a week later. But this program is only a year long, so I'll graduate in March, the middle of March, with my psychiatric nurse practitioner degree, and I plan to use both of them so I can treat the patient as a whole, mentally and physically. All right, guys, signing out, and I will talk to you guys later. Thank you. Thank you. If I can end it.